Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and here today with another of our COVID updates. Joining me today in the studio is Brian Mahoney. Brian is one of the epidemiologists who works at Douglas Public Health Network, and we'll talk with him later about some of the things that he has seen in this pandemic. But as always, we start with the world view and then move down to the local. In the world, COVID is about stable over the last week. Almost all of the continents are seeing little hotspots, but overall, COVID has been pretty quiet. In South America, Brazil is having a resurgence. In Europe, the UK and Israel are still seeing a relatively high number of cases following their Delta outbreaks in the last month. In Africa, we still see little hotspots, especially in Southern Africa. And that's a worry because in Africa, they have a very low immunization rate and pretty rudimentary healthcare system. In Asia, it's pretty quiet. Japan, which had a big spike after the Olympics, is now quiet again. But we're starting to see some activity in the Philippines, which is always a worry because they too have a low immunization rate. Malaysia and Mongolia, two countries that have struggled over the last few months, continue to struggle. In the US, we're starting to see for the first time in many weeks a decline in the number of cases. And that truly is a good thing. You remember this outbreak started about 8 weeks ago in Missouri and Arkansas, then moved its way down to Louisiana, swept across the Gulf states, and is now most active in Kentucky, Tennessee, and West Virginia. But we're starting to see activity in other parts of the country, especially in Wyoming, which has a lot of disease, the northern panhandle of Idaho, parts of Nevada, and especially in Alaska. Now, there's not a lot of people in Alaska, so it doesn't take a lot of cases in Alaska to increase the rate, but they have some really of the highest rates in the country in parts of Alaska. In Oregon, we're seeing a declining number of cases. The Portland area and Multnomah County, Benton County are relatively quiet, but we're still seeing a fair amount of disease in Southwest Oregon and along the Columbia Gorge. And Douglas County is thankfully down. So we had been over 150 cases average for a while, and we're down now to less than 100, and that's a good sign. However, our hospital remains quite full with over 70 people in Douglas County residents hospitalized, so a high number of hospitalizations and a continued high number of deaths, and that is really worrisome. So we've had over 100 deaths since the beginning of August, and that really is a worry. You'll know in a small county such as Douglas County, we typically have about 100 deaths and 100 births a month. So to have these 100 deaths over the last 6 weeks, in addition to the other kinds of deaths that we've had, has really been bad. What we have seen, though, is that the vaccine is still quite protective, that people who are vaccinated are 5 or 7 times less likely to get the disease in the first place and 10 times less likely to be hospitalized or to die of COVID. So the vaccine still seems to be working. We have more data in about the safety and efficacy of the vaccine, and it still seems to be 90% effective or so in preventing hospitalization or death and 75% protective in protecting against disease. So those are great things. In terms of new side effects, there are no new side effects that have come up. We still know about the myocarditis from the mRNA vaccines, although that does seem to be rare. And so recent good studies suggest that getting the disease is much more dangerous than getting myocarditis than getting the vaccine. And with the blood clotting issues, while they've still been noted, they seem still to be rare. And again, you're much more likely to have a blood clotting issue from getting the disease than getting the vaccine. So the vaccines are safe, the vaccines are effective, they're still widely available, and their good news is that they're free. So we're still encouraging people to get the vaccine. Testing is still widely available. Not only can you get it at places where you previously could, like your doctor's office and urgent care, but now there are over-the-counter tests, which we have found to be really quite effective and quite accurate. So let's take time now to talk with Brian. So Brian Mahoney is one of the epidemiologists from DPHN. So Brian, tell us about your rather amazing background.
Oh, thanks, Dr. Bob. Well, I think it's year 38 in my public health career. At least it should be by this time next year. So I'm in my 38th year. Yeah, I'm local. I grew up in Roseburg and graduated from Roseburg High School, and then went to college at Portland State, degree in health education, certificate of public health studies. Went in the Peace Corps, did water sanitation in Kenya for a couple of years. Saw a lot of vaccine preventable diseases there. Came back after a couple of years overseas, then started work with the Oregon Public Health Division in water and sanitation, doing sanitation work. And then CDC was hiring at that time. And that was right at the beginning of the HIV/AIDS epidemic. So in 1987, I started, and I worked with CDC from 1987 to 2002, so 15 years. And in that time, I did a lot of what's called disease intervention work, following cases, finding people, getting them treated or getting contacts in. And then they also sent me to the WHO to work with polio eradication. So polio eradication is vaccine preventable, and worked in Geneva as the global polio technical officer, keeping track of the 500 million children and all of the national immunization activities that were going on at that time. Now, polio back then were probably hundreds of thousands of cases, and now we're down to 1 or 2 in the whole world. So vaccines really work. I'm very much a vaccine proponent. And so I worked with the National Immunization Program at CDC. And I believe that we'll be talking about the vaccine adverse event reporting system, which is at CDC. And that was started in about 1990. After my time at CDC, came back to Oregon and began working with the Oregon Public Health again in the public health emergency preparedness and response, which is to prepare for things like outbreaks and pandemics and other public health threats and emergencies. So that's kind of put me in a couple good places and to be prepared to do this type of work. And then I was also the public health director at Clatsop County Health Department. And then a few years ago, moved back to Douglas County, and Dr. Bob and crew decided that they would take a chance on me and put me to work.
Well, it wasn't much of a chance. So with that background, you're probably one of the most experienced people in public health in the state, and we're so very glad to have you. So you basically watched through polio where we went, where the disease was widespread to nearly eradicated with the use of a vaccine program. And I know there was a lot of resistance to polio vaccine in other parts of the world. Can you talk about that vaccine resistance and how it relates to vaccine resistance that we're seeing today with the COVID vaccine?
Yeah, I think the biggest parallel is probably the misinformation that goes along with that. Overseas, I had seen that there's misinformation that says vaccines are going to sterilize our children. So that's not how it works. And one of the ways that we were able to sort of get over that hurdle was to find people in the communities that people would actually listen to, and then take advice from them. So it could be a religious leader, a political leader, a community leader of some sort. And what I saw was that if that leader were to pick up their child or their grandchild, and polio is not an injection. Polio, at least overseas, it's not a needle and an injection. It's an oral drop, 2 drops on the tongue, a month apart. That's how they do the vaccine. So they would hold the child and then put the drops in the mouth and say, if I thought it was going to sterilize my child or my grandchild, would I be doing this? Probably not. So that was one of the ways that they could fight that.
So it is interesting during this COVID time that one of the most potent parts of misinformation is that this vaccine is somehow going to affect fertility or cause impotence. And it is interesting that although there's absolutely no data for it, that seems to be a narrative which has been hard to defeat. what other narratives did you see with polio that you were able to overcome?
Well, I don't think that there was one that matched that misinformation that's really parallel with what's going on now. It was mostly getting the vaccine, making it accessible, and through WHO, through the Polio Eradication Initiative, through the work that Rotary International did, they did massive national immunization days where every child under the age of 5 would get vaccinated on the same day. So that took a lot of micro planning at the local level, a lot of national planning, a lot of international planning. I don't see that here. I mean, we're trying to get the vaccine out, but there's been no real, this is going to be vaccine day. We're going to do it all in one day. And they would do that not just in one country, but they would do that in a whole region. So the whole Asian region, the whole sub-African continent region would all be done like that. I just don't see anything like that today.
And that seems to be sad because the big advance in medicine has been the eradication of smallpox, which is totally due to the vaccine. And we're very close to the eradication of polio. And those are being done worldwide in really impoverished countries. And the fact that we can't muster a better effort here in our great and advanced country does seem to be a shame. Well, one of the things that I've seen with misinformation is that people have looked at the VAERS system, which is Vaccine Adverse Event Reporting System, and they see a lot of reports of problems or deaths in people after they've gotten the vaccine, and they take that either to mean that this is a dangerous vaccine or that everything that's in there is caused by the vaccine. So Brian, I know you've been involved with VAERS for a long time. Tell us how you see this.
Well, VAERS is what's called a passive reporting system. So that means that anybody, anywhere, anytime can actually just go make a report in that. But what it does not do, it does not determine, VAERS itself, just by being a report, it doesn't determine whether a vaccine caused a health problem. What it's trying to do is sort of it's like a vacuum. It'll pull everything in. And then somebody has to go through all that and see if there's anything worth mentioning, whether it's an adverse event, if it's brand new, because there seem to be some new things that might come along, or not usual or not even related. One of the, I remember this pretty distinctly, we're talking about the vaccine reporting system, and it said, well, you could drive out of the doctor's parking lot in your car and get into an automobile accident, and that can be reported, but it has nothing it's not causation. It's association, but it's not causation. And so there's a lot of stuff that goes into VAERS, which is associated, but it's not causation. And then they have to do a whole bunch of work. The doctors, the medical officers at the FDA and at CDC have to do a whole lot of work to separate sort of the noise from the signal. And that's what they call it, the signal. What is the signal, the health signal?
So yeah, early on, what I said was, if you got the vaccine and the next week won the lottery, they would both be true. You got the vaccine and you won the lottery, but I don't think any of us would say that you won the lottery because you got the vaccine. But similarly, things happen, especially when you've given this vaccine to hundreds of millions of people. There are going to be some things that happened. So a friend said that they had a friend who got the vaccine and 3 weeks later got a detached retina. Yeah. And so the question is, did the vaccine cause the detached retina, or detached retinas just occur? Clearly, way before we had the vaccine, people got detached retinas. And so it's a little hard then to know. So that report might be in the VAERS system. And my understanding is the way they look at this is they look at what they think the background rate of detached retinas are. And if they're seeing an increase in that background rate, then that would suggest that perhaps there is some tie between this. And so for detached retinas, there's absolutely no tie between the vaccine and detached retinas. But my understanding is the VAERS system was helpful in picking out the clotting problems that we're seeing with the J&J.
Yeah, that seems to be true. Again, you have to be able to separate all of these things, but there is a background rate. And VAERS is not the only system. I don't want to get off too much off the topic, but VAERS is not the only system for reporting things. There are actually some active surveillance systems out there that are being matched with VAERS to see what's actually going on. And some of those are like the Vaccine Safety Data Link. So the Vaccine Safety Data Link, it connects 9 managed care organizations like Kaiser Permanente with 9 million patients. An example of this was back when, in 1998, when there was the rotavirus vaccine. It caused a condition in very young children called interception. And it was helpful that Kaiser had such a large database that they could match the background rate with the increase of this thing, which is actually very, very rare. And then there are a couple of others that also do the similar things. There's the Clinical Immunization Safety Assessment Network, which ties into 7 academic medical centers and CDC, and they target things like risk and adverse events and contraindications, because there might be some contraindications, which means, well, you shouldn't get the vaccine at this time. So that helps kind of sort things out so that there might not be an adverse event if the vaccine is not given due to the contraindications. Likewise, there's a licensure for the vaccines. There's a post-licensure rapid immunization safety monitoring system. It was based on work that they did in 2009 during the H1N1 pandemic flu, and it's been expanded since then. And it connects the federal or the Food and Drug Administration with 9 state immunization registries. So they're able to use at least 3 other systems in addition to VAERS, but these 3 other systems are more specific to what's going on. VAERS is more sensitive. It, like I said, it collects lots and lots of things. So if it's out there, it'll probably collect it. But these other systems are to really separate the wheat from the chaff or the noise from the signal.
And you don't hear much about those active systems. They have a very active system in Israel where they have managed care systems, and they've looked at this. They looked at people who had neither the disease nor the vaccine, people had the vaccine and not the disease, or people had the disease and not the vaccine. So the 3 different groups. And what they found was that in the group of people who were vaccinated, in general, they did not have increases in side effects, except for a few things. One was they did seem to have more swollen lymph nodes, which we know happens in some people after you get the vaccine. They saw a slight increase in the amount of myocarditis, which is inflammation, in comparison to people that had neither the vaccine nor the disease. But the thing that was most impressive was that the people who had the disease were much more likely to have heart problems, much more likely to have bleeding problems, much more likely to have MIs and strokes. So it showed very clearly that although the vaccine was associated with this rare myocarditis, it was not associated with many of these other things, and that it was so much safer than getting the disease. And so VAERS is part of the system, but I think anybody who's looking at the number of reports in VAERS and then trying to draw any conclusions from that is really not giving you the whole story. In addition, I've been a VAERS reporter for years because I've been doing pediatrics since the 80s. And previously, reports to VAERS were voluntary and encouraged. However, with the COVID vaccine, they're mandatory. And because of that, there are just a lot more things reported in the VAERS system with the COVID vaccine. That doesn't mean it's any safer or less safe. It just is a difference in the way we report. So, Brian, I know you're looking at these reports all the time. And have you seen any other safety signals?
Well, they're usually adverse events are usually things that can be very common, like sore arms and a fever. But in any vaccine, that's usually the case. That usually happens like 1 in 100 doses. There can be some other moderate things that happen, like febrile seizures, when somebody gets a seizure after getting a fever. That's a little more moderate. That's a little more severe than just a sore arm and fever. That happens about 1 in 10,000 doses. And then truly severe things like anaphylaxis, the shock, that's like 1 or 2 in a million doses. Now, this is not specific to the COVID vaccine, but that's the background rate of everything that's getting reported through VAERS and these other things. There are several other things that can be seen. Guillain-Barré syndrome, which is like a polio-like type of thing, can happen. I think you mentioned a few others, like the myocarditis. There's a transverse myelitis can happen. There's the cerebral venous sinus thrombosis, which was picked up actually through the system, which was good, and so that's why it was put on hold. The vaccine for a short time is put on hold just so they could do a record review. They do the record review actually by following up with the actual medical case record. So they aren't just like put into the hopper and see what comes out. They actually go out and this is a sensitive system. It gets everything, but then it turns into it's more specific by sending these medical epidemiologists out to actually do the case investigation, see what's actually going on.
So my conclusion is that for the safety of the vaccines, they really are looking at it pretty carefully. Yeah. And except for the things that we've just noted, the vaccines are really safe. And it's so much safer to get the vaccine than to take a risk and get the disease. So much more
safe.
So much safer, as well as you can help protect others. Yep. You know, with the deaths we've had over this last 6 weeks, it's really humbling how serious this disease can be. So, Brian, thank you again so much for joining us today.
My pleasure.
We will do this again next week. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.
Thank you.